Now, with a look at how nurses are working to impact employment policy, let's get the latest from the Center Square regional editor, Christen Smith. Christen, your latest story highlights how nurses are tying paid family leave to broader community benefits. Essentially, it seems that they're bargaining on behalf of everyone rather than just their own contract. In reporting on this, what stood out to you about how nurses are making that connection stick with the public and with policymakers?
Well, for parents across Pennsylvania, of which there are 3 million, and across the country, as a matter of fact, we all know that taking time off of work to give birth and to recover from childbirth is often expensive, and we give up our paychecks as a result. Nurses, of course, want to see this fixed for themselves, but if there was also a government level mandate, whether that's local, state, or federal, then this would mean that not just themselves, but their patients could benefit from several weeks, if not up to 3 months of paid family leave so that they could recover. There'd be less chances of high mortality. There would be less serious complications from having to rush back to work. And so they really see this as an issue that's far beyond just what makes them comfortable and what would bring more nurses into the profession.
So obviously, this isn't just about hospitals and the medical industry. The overall conversation seems to be about trying to get paid medical leave across all industries. What have the hospital systems had to say about this? What's the private sector had to say about these pushes?
So I spoke to the University of Pittsburgh Medical Center. That's our biggest hospital system in Pennsylvania. I asked them about paid family leave, particularly for their nurses in the upcoming contract, but also, in at large. And they really stood by their current benefits. Right now, they offer 2 weeks of paid leave. And they said that they were an early adopter of this and that they continue to offer the most competitive benefits in Pennsylvania. It's important to note that being said, we still have 20,000 unfilled nursing positions. That's the most of any state in the country. And certainly that loss is experienced by taxpayers and patients who come to the hospital or go to their doctor's office every day and are getting that reduced standard of care.
So when it comes to the hospital situation, they've got a contract ongoing, but again, you've got the public sector, the rest of the employers out there, and even the private sector and small businesses and whatnot. What are some of the things that are being discussed at the State House concerning paid family leave, and what's some of the pushback been?
The State House recently passed something called the Paid Family Leave Act, and this would apply to state workers, but it would give them partial wages for up to 12 weeks after the birth of a child. And this is something that has been bandied about in the state legislature for years. There's always been a concern that it would cost too much money and that the government wasn't well suited to handling such big programs. And the arguments against this were no different, really. And although it passed the House with bipartisan support, 92 Republicans were very against the idea, saying that it would cost $4.5 billion from taxpayers. We're not just talking from parents and family members who would be benefiting from this, but from all taxpayers who have to share the burden of these costs.
Yeah, you got to imagine, there's going to be a cost there to pay somebody who's out sick with themselves or their family, but also pay somebody to fill that position while that individual's out. While sometimes I know, especially if people are looking at things from a government perspective, there's always a free flow of money. But I mean, these are tax dollars being used here. How does that translate to the taxpayers, say, who are small business owners? Are they looking at the possibility of having to maybe in the future have paid family leave to some degree or another?
Certainly, it depends on what happens at a policy level. Right now, the paid family leave program that the State House just approved wouldn't apply to them. But of course, unions and nurses in Pittsburgh in particular want to see this extended across all sectors, across to all taxpayers. And so, like I said before, that doesn't just mean parents who are taking family leave. That is everybody who goes to a hospital, who collects a paycheck, who is going to be paying for this in one way or another. And that is what somebody's going to have to weigh in their mind. The most immediate cost is going to be every day in their check for employers who are going to have to cover that mandate one way or the other. Now, there is another side to this where you would be feeling it in a way that's not necessarily through your paycheck would be, okay, well, if the union got their more immediate demands for better nursing staff ratios and more paid family leave, well, then there is, according to their logic, we would see better patient care. We would see reduced negative health outcomes for mothers and babies, and we would be receiving a higher standard of care in that line. But again, someone has to pay for that.
Christen Smith, regional editor for the Center Square. Finally, here, just if you could, how impactful are these unions? We see it here in Illinois every budget season. Unions representing nurses, service employers international union, service employees international union. These types of labor unions really clamoring together to try to get certain policies in place. How impactful are they, and is it just on a state level?
In Pennsylvania, certainly they are a huge impact, and lawmakers, their campaigns wouldn't exist without the support of unions. And in fact, Donald Trump's support in this state has, in a large way, hinged on the fact that he's had labor unions defect in support of a Republican candidate. That's not something that typically happens, and that, as anyone knows, made the huge difference in the 2024 election. But certainly Pennsylvania is not the only state with a strong union presence. And so, like you mentioned, in Illinois and other states, unions spend a lot of money on political related activities to get the candidates that will support the policies that are best for their collective bargaining agreements. Now, that may look different in every state, but in Pennsylvania, certainly they are a force to be reckoned with. They're not somebody you want to have on your bad side.
Especially with the amount of money that unions throw around, from education unions to nursing unions and beyond. Definitely something to consider as we are in this election year for 2026. Christen Smith, thank you so much for your time here with the Center Square Daily.